Welcome to Group 3's capstone presentation on mobile health clinics, presented by John Kim, Makeda Bird, Jessica Felder, Grace Modozi, and Hanumanth Ravindranath. Thank you for joining us today. We need to bring the exam room to where the patients are. Dr. Jay Sanders, a telemedicine pioneer. The iron triangle of healthcare consists of cost, quality, and access. As such, addressing healthcare access is crucial for many Americans, particularly rural Americans. Healthcare access has long been a struggle for many rural Americans due to various reasons such as lack of health insurance coverage, insufficient means of transportation to access a medical facility, and geographic hurdles that force rural residents to travel unreasonable distances. Increased time off from work and lost wages adds up to simply foregoing the doctor's visit altogether. As a result, timely access to even basic health care becomes a major issue. Severe health disparities are common among the rural population in the United States. This is a significant issue as nearly 20% of the population live in rural communities. The difference between healthcare and healthcare services received for these patients compared to those in urban areas, therefore, must be addressed. The ACA was signed into effect in March 2010. It was an effort to reform the American healthcare system by providing health insurance to millions of uninsured Americans, while lowering the associated costs. The main goal of this act was to increase access to healthcare to those who were previously uninsured or unable to access quality care. By 2016, only 8.8% of Americans lacked coverage, compared to 23% in 2010 prior to the ACA taking effect. Despite having coverage, however, in 2018, there are still numerous Americans who struggle to access care because of their actual living situation. These individuals simply cannot obtain adequate medical care due to transportation-related issues. The Mobile Health Clinic program endeavors to increase healthcare access, decrease cost, and deliver quality health care that can improve the health outcomes of this population that makes up a significant portion of Americans. The expectation of this service is to not only offset the apparent healthcare disparity between rural and urban areas, but also to increase screening and awareness so that this population will play an active role in their healthcare outcome.
The mobile health clinic and who we are. The mobile health clinic will give healthcare providers a platform to deliver medical services to underserved rural neighborhoods. The mobile health clinic will be able to travel to various underserved communities to offer affordable and in some cases free medical services. The mobile health clinic front door service is quick and hassle-free. This model will remove logistical constraints such as transportation issues, difficulties making appointments, long wait times, complex administrative processes, and financial barriers such as health insurance requirements and co-payments to individuals living in these rural communities who lack proper medical care. The mobile health clinic and what we do. The mobile health clinic's customized outreach trailer will be equipped and staffed by a nurse practitioner or a primary care physician, also a certified laboratory medical technician. The trailer will circulate through rural communities to offer phlebotomy services, routine physicals, immunizations, and treatment for minor illnesses. These wide range of services will be cost-friendly and extremely convenient for residents in rural neighborhoods. In addition to providing routine medical exams as well as chronic disease care, the mobile health clinic will also provide testing for diabetes and urinary tract infections. Rapid tests will also be conducted for influenza, strep throat, and pregnancy.
Who would the mobile health clinic serve? The population that's going to be targeted by this mobile health clinic are those who have difficulty accessing care due to their geography, their insurance coverage, or their financial situation. Currently, 72% of America's land area is considered rural. This is the home of 46 million residents. These residents have an especially challenging access to care issue because of all of the three reasons provided previously. The benefits of having a mobile health clinic: it'll strengthen prevention, there will be chronic disease management, a decrease in healthcare expenses and costs, and improved health outcomes. Risks and roadblocks. There are certain risks and roadblocks that are faced by a mobile healthcare unit. They include fragmentation of care, which is due to the fact that the mobile health unit is not fully emerged into a healthcare system, so there is a lack of extensive connections with hospitals, specialty clinics, pharmacies, and ancillary services. There also is the potential for financial issues since these are often run as non-profits, which makes it challenging to maintain maintenance costs. There's also the potential for financial loss if anything were to happen to the vehicle, such as vehicle maintenance, bad weather, or any other circumstances surrounding the vehicle. Spatial and structural constraints. This is a smaller workspace. The employees will be working in a trailer, so there is a threat to confidentiality because of the limited spacing. There's logistical challenges that include staffing difficulties with recruiting and retention. The location: where's the unit going to be parked, and who receives the services in the area? Factors for and against mobile health clinics. Factors for mobile health clinics: they're tailored, high impact, and affordable health care. They provide services for those who would not otherwise have access to the services, and these services provided include urgent care services, preventative health screenings, and they can initiate chronic disease management. Another factor for mental health clinics is there are only 2,000 mobile health clinics in operation right now, which makes the supply and demand way off balance. Against. The factor against the mobile health clinic is the location. The unit will constantly be moving, so as mentioned before, the risks and roadblocks of the fragmentation of care. And there's also the lack of knowledge regarding services in new areas. The mobile health clinic will function mainly on word of mouth, which can be challenging if people are unaware of the services that are provided. Government approval. In order to run the mobile health clinic, a state certification of need will be completed. This determines if the mobile health unit is appropriately established to limit the unnecessary inflation of healthcare services. There must be licensed providers on board to provide care to the patients, and we must meet motor vehicle and safety standards. Groups that are in support of the mobile health clinic include the American Hospital Association section for small and rural hospitals, the Association of Clinicians for the Underserved, the National Association of Rural Health Clinics, the National Center for Frontier Communities, the National Organization of State Offices of Rural Health, the National Rural Health Association, the Mobile Healthcare Association, and Capital Development Grant Technical Assistance.
Specific target populations within the country benefit from mobile health clinics based on the challenges with healthcare access due to various circumstances. These circumstances differ, but each target population shares the same challenge with healthcare access. The first target population for mobile health clinics are those that reside in rural populations. Rural populations make up for nearly 20% of the country, which translates to 60 million people. The geriatric population benefits greatly with the ease of access to healthcare from mobile health care clinics as well, and is expected to grow within the next decade. It is estimated that 76 million baby boomers will reach retirement age within the next decade. Finally, the disabled populations that have difficulty walking will also benefit from mobile health clinics. There are approximately 30.6 million patients that have difficulty walking or use a wheelchair. The key stakeholders within the mobile health clinic process are policymakers, patients, payers, and providers. Policymakers and legislators determine and facilitate the development of incentives and regulations for the mobile health clinic stakeholders. Patients are the direct consumer of mobile health clinic services. Payers are third-party benefit administrators that impact coverage of mobile health clinic services for patients and providers. Providers provide mobile health clinic services to patients. Marketing efforts for mobile health clinics are leveraged to drive awareness and education for the patients that utilize its services. Electronic communications are one of the most effective methods of marketing due to the efficiency behind this method. Not to mention that there are more than 6 billion cell phone subscribers today. For areas or populations that do not have access to technology, flyers and word of mouth are still effective means of marketing. While mobile health clinics have proven to be quite effective for target populations of the services provided, it is also true that challenges still exist. Reasons for interferences for success in mobile health clinics include lack of commitment from the government in funding and improper distribution of resources. These complications usually derive from lack of dedicated funding sources, unclear procedures, and unstable infrastructure. As recommendations to remedy these challenges, mobile health clinics can partner with large health systems to adopt and promote existing infrastructure and processes. Additionally, strong partnerships with health systems will promote positive policy decisions through lobbying that will impact funding for within both state and federal government.
Mobile health clinics have a diverse spectrum of organizational and funding arrangements. They are primarily funded through philanthropy as well as independent companies and private insurance providers. Other common sources of financial support are through city and county government, state money from the tobacco litigation settlement, and money distributed to states for disaster preparedness. They can also receive funds from federal programs such as Medicare and Medicaid reimbursement for mobile services and other programs. Grants from the National Health System, Health Resources and Services Administration are a central source of financing for some of these mobile health clinics. Other grant sources are particularly private foundations and corporations grants, which have enabled mobile health clinic to staff or purchase mobile units. They can also receive grants from U.S. Department of Health and Human Services Office for Minority Health.
In an attempt by healthcare providers and administrators to improve quality while reducing costs and increasing access, They are searching for new and innovative ways to reach communities and educate and empower the patients to take an active role in their own care. The Mobile Health Clinic is one such innovative and successful, yet underutilized initiative that could bring a lot of change to how we access healthcare, especially in the rural communities where lack of healthcare delivery is rampant. Although the initial capital and credentialing needed to implement the MHC might be seen as a daunting task, hence the underutilization of this initiative, the long-term benefits of MHC for rural populations is far-reaching not only in terms of current medical conditions, but as a preventive measure. These mobile health clinics definitely have the ability to decrease the disparity in healthcare between rural populations and their urban counterparts. We thank you for listening to our presentation and welcome any questions you might have at this time.